Of all the hidden dramas playing out in our bodies, few are as quietly consequential and as easily missed as the relationship between vitamin B12 and intrinsic factor. Even when someone consumes plenty of B12-rich foods, their body can struggle to absorb this vital nutrient if intrinsic factor, a special protein produced in the stomach, is missing or impaired. The result is pernicious anemia, a slowly progressing but potentially devastating condition that illustrates the essential and mysterious partnership between digestion and micronutrient absorption. Intrinsic factor is produced by parietal cells lining the stomach. Its only job is to bind vitamin B12, forming a complex that travels through the digestive tract until it reaches the terminal ileum, where specific receptors recognize and absorb it into the bloodstream. Without intrinsic factor, B12 passes straight through the intestines, no matter how much is eaten, like a key tossed away before it ever meets its lock. The classic cause of intrinsic factor loss is pernicious anemia, an autoimmune disease in which the immune system attacks the parietal cells, or intrinsic factor itself. Over time, these attacks lead to chronic atrophic gastritis, stomach lining damage, and a complete absence of intrinsic factor. But intrinsic factor loss can also occur from other stomach conditions: surgical removal of part or all of the stomach, gastrectomy, long-term use of acid-suppressing medications, or chronic H. pylori infections that damage parietal cells. The stealth of pernicious anemia is one of its most troubling aspects. Early on, B12 stores in the liver mask the problem for years or even decades. When symptoms emerge, they can include profound fatigue, pale or jaundiced skin, shortness of breath, and neurological signs like numbness, tingling, or difficulty walking. Cognitive and mood changes can also appear, sometimes severe enough to mimic dementia or major depression. These signs often develop so gradually that patients, and even doctors, attribute them to aging or unrelated chronic conditions. Meanwhile, lab tests can deepen the mystery. Because serum B12 levels can remain borderline or fluctuate, many cases of pernicious anemia are missed if clinicians don't think to measure specific markers: intrinsic factor antibodies, parietal cell antibodies, methylmalonic acid, or homocysteine. A diagnosis requires a high index of suspicion, especially in older adults with unexplained anemia or neurological complaints. Perhaps the most sobering fact is that without treatment, nerve damage from B12 deficiency can become permanent. Yet the solution, once identified, is straightforward. Lifelong intramuscular or high-dose oral B12 therapy bypasses the need for intrinsic factor, restoring adequate levels and halting progression. Many patients experience dramatic improvements in energy, cognition, and neurological function when treated early, an inspiring testament to the power of targeted, root-cause medicine. The gut connection between intrinsic factor and B12 absorption is also a cautionary tale. It reminds us that nutrition isn't just about what we eat, but also about how well our bodies can absorb and utilize it. This insight is especially important in an era of widespread use of acid-reducing drugs, rising rates of gastric surgery, and increasing awareness of autoimmune conditions, all factors that can quietly undermine intrinsic factor and B12 status. Ultimately, the mysterious partnership between intrinsic factor and B12 reveals a deeper truth. Our health depends not only on the nutrients we consume, but also on the often invisible processes that enable their absorption. Recognizing and respecting this connection empowers us to catch hidden deficiencies before they cause lasting harm, ensuring that even the most essential micronutrients reach every cell that depends on them.